Good morning. Sorry about this late start. We just have some technical challenges. But on Saturday, everybody is logging in. So I want to welcome you again to another edition of Monitor Your Health, where we educate the public on important issues relating to health around the world, but most especially in Nigeria. Today, we have a very important topic. Pardon me. My name is Dr. Femi Ogunremi. I will be your host for today. So we know that in our country, there are a lot of things that we can do. And we do, as a member of the public, we can go to the chemist, we can get medications, we can treat ourselves, we don't need prescription for a lot of things, even though legally speaking, we should be doing, but I'm not sure how much of this is enforced. So today we brought somebody who can help us to enlighten us and tell us a lot about what's our own role as a patient, and also to advise our service providers on the right way to handle our medicines and prescriptions. I would like to welcome today Mrs. Folashade Lawal, a medicines information expert. You're welcome, madam.
Thank you, Dr. Ogunremi. I'm very delighted to be back. Can you hear me?
Yeah, we can hear you. A bit crackly, but it's okay.
Okay. Yeah. Thank you, Dr. Ogunremi. Thank you, Monitor Healthcare. It's a great work you're doing, and I'm glad, very happy to be part of this. My name is Folashade Lawal. I'm a pharmacist. I have practiced community pharmacy for at least 31 years. I run Victory Drugs Pharmacy in Festac, and I have some experiences to share with us today on this program. I also have training as a medicines information pharmacist.
Thank you. You're welcome. So just to crack into it, we talked about drug abuse, medicines abuse. What do they mean? Can you just throw some lights into that for us?
Okay, generally when we talk about medicines abuse in terms of prescription, we're looking at obtaining prescription drugs without prescriptions, especially for the purpose of recreational purpose, or to abuse, to use a drug in a way that is not medically allowed. It doesn't follow medical guidelines. Or sometimes there's a prescription, but we use the wrong dose deliberately because we want to get excited, or we want some other effect from the drug than is desired. So when that happens, we say we are abusing the medication.
Okay, thank you so much. So you talk about, taking medications according to guidelines. Do we even have guidelines in Nigeria?
Yes, well, medical guidelines in terms of the patient, between the patient now and the prescriber. If it's a prescription drug, the prescriber has set a certain procedure for the patient to go with. Now, when the patient goes outside that, for example, if maybe it's an opioid drug and it's meant to relieve pain at a certain dose, and the patient decides to exceed that dose deliberately, probably because he wants to feel high, or the patient will need that drug in the first case and just got the prescription fraudulently, then it's not going according to medical guidelines.
Right. Okay. Thank you so much. I just wanted you to throw some light at that, because some people will ask that question. Now, so when an individual take a medication, maybe that is prescribed to them, or maybe not prescribed, but it's supposed to be within maybe a certain dose, is for a certain period of time, and they take it wrongly within that sphere. That's what we're talking about, a kind of abuse in that case. Am I right in that thinking?
Yeah, when it is deliberate and the intention is to get himself probably high or do something other than what the doctor wants,
Right.
then it's an abuse. That's different from misuse.
Okay, so please, what's the difference between these two?
Well, there's a thin line, but it's clear enough. When it's misused, most of the time it's not with the deliberate intention to harm himself or to get high. The patient probably inadvertently overdosed himself or underdosed himself or just decided, for example, some hypertensive patients, when they're taking their medication normally, they might probably just feel somehow in the afternoon, measure it and think, oh, it's higher, then take another dose. Now they are trying to just help themselves, but it is a misuse of that drug because it is outside what the doctor wants them to do.
Okay. So what are the risks or the danger associated with some of these, acts?
A lot of dangers because the patient can harm himself in the process. Let me take another example of misuse. If a patient decides, probably is asked to take a drug once a day, and he decides to take it twice a day, that's an overdose, and it could be injurious to his health. It could damage some organs, and over time, the organ collapses. So there's a dose that has been scientifically calculated for that medication, and we are expected to stay within that because a drug on a normal day or a medicine is meant to help.
Yes.
It's meant to alleviate. The major design is to cure. That's the desire of the prescriber. But when it is misused, it can become a poison to the body. It can harm the body because there's a limit to what should be taken and there's a time frame for it. When the patient now decides to go outside that, then the patient is looking for trouble for himself.
Right. Okay. So I hope the viewers can grab this. When you're given a prescription, the prescription is meant for a particular purpose. And what our pharmacist is telling us is this dose is being calculated. It could be based on your weight, your height, something that they've given you that is just appropriate and just okay for you. When you go outside that range, then you're exposing your organs. The medicines are being taken care of in your body, and then if you overdose it, then a particular organ might suffer, and that might lead to the damage to that organ and damage to other organs in the body. Okay, so Mrs. Lawal, in situations where somebody genuinely just wants to take the right dose, I mean, that's the intention. But in our society, where I could just see all these hawkers, these people that sell all these herbal preparations, and I just decided to take it, especially around this time. A lot of people can't go to see a doctor because of COVID, and I've had situations where we've had people coming in because they've actually, they come down with the symptoms that looks like maybe kidney or other organ, injury because they've been taking other medications that are not actually prescribed. What do you advise people on this?
I advise us at this period to be very careful with drugs. And we have a pharmacist that we can talk with. Even if we cannot go to the doctor, many of them are still available online, and we need that guidance so that we don't harm ourselves. The alternative won't be quacks because we can damage our organs through them. So we need those who have the knowledge to guide us on what to do. So I advise strongly that you talk with your trusted healthcare professional, you talk with your pharmacist. Some of us can still call our doctors up. So talk with your doctor. Part of what I have noticed in this period is that people are afraid It's not necessarily only that the doctors are not accessible. Some of them don't even want to consult with the doctor because they don't want to get any diagnosis that is COVID related. I recall a client that complained of back pain, and from my interaction with him, I thought that we needed to involve a doctor. Initially, he was going to go along with me. Along the line, I said, Madam Richie, I hope you are not going to hand me over to COVID people. And I said, your symptoms have not even suggested anything COVID. So let a doctor at least assess you online, and then from there, we know what next to do. So people are actually afraid. Some people are afraid, and they're not seeking help from the right places. So we need to cultivate the habit of seeking medical help from the right quarters. I keep saying that your health is like a vehicle or a car, and you should just occupy the driver's seat and make sure that you take charge so that you can safeguard your health. Drugs or medicines are, so once you put them in, you don't know what they're doing. You cannot see them. You cannot tell them, don't go there, go here. They become the boss, they take over. And then if you have used them wrongly, then they will act wrongly and your body gets into trouble. It could be as little as maybe a drug should be before meal, and then you take it after meal. It could be as little as that, and then it could create a problem. I also recall some years ago when we had this anti-malaria that had erratic absorption after fasting meal. And the instruction was to be taken before meal. I know somebody decided that, oh, that pharmacist has said before meal. He's a small boy. He doesn't know that people don't take drugs before meal. That was what the patient told me later. So he decided to sit down to a bowl of eba and goosey soup and all the oil, and then took it immediately after. And then we got into trouble. We started having arrhythmias, and they had to be rushed to the hospital. Thank God he made it. So those little instructions, you won't get them from the hawkers. You won't get them from quacks. You need to just still stick to your trusted healthcare professional, especially in times like this is when you need them more.
Right. Thank you so much. I think you've touched on a very important area. You know, when we have so many people scared, so everything now they feel, wow, that is COVID, and people are running away to be labeled as COVID. I think it's very pathetic. I had a situation recently when, well, somebody discussed with me, a patient or an individual who came down with kidney injury purely because they were self-medicating. They didn't want to go to the hospital. And then by the time they came, things were really bad. So please, viewers, it's very important for us to know that there's a very thin line between what's right and what's wrong, especially when you want to self-medicate, when you try to take things into your own hands and you decide to maybe buy a bit of this there, a bit of that there, and then you combine it with some concoction. What I can't even get my head around, Mrs. Sawa, is the fact that when people buy some of this concoction, when I hear people, advertising this product, people will say one product can do everything. It's really scary. You take this one, it cures headache, it cures stomach pain, it cures, back pain, it cures impotence, it cures breast cancer, it cures that. It frightens me because you don't even know what you're taking. Yeah, by the time you keep taking, I'm not against herbal. I'm against the fact that we can't quantify what we're taking, and that's a big thing. Somebody's just asked a question here. In a situation whereby one has been treated for malaria before and knows the drug that was prescribed, and now you're feeling feverish again, and you get the drug on your own, is this a drug abuse?
Interesting. Well, that is not drug abuse, but it might be misuse because there was no diagnosis this time around. We need to have a diagnosis. So many things can give you a fever. Malaria symptoms are not specific. So the only way you can know that you have malaria is to do a test that will show that you have malaria, or consult with your doctor. Let your doctor guide you. You can, with malaria, you can also talk with your pharmacist. Let them guide you so that you know that you are doing the right thing in the circumstance. But it's very important that we don't just decide. You know, sometimes they'll tell me, I know how my malaria is. I know how my typhoid is. And then you keep taking medication, avoid the case layer. This person keeps treating imaginary typhoid and malaria until at the end of the day, we found out that he had hepatitis. So you cannot just say, okay, the last time I felt this way, it's not only malaria that applies to. That applies to so many other things. I felt that way, the doctor gave me this, or my friend felt that way, the doctor gave me that. So I can just key into it. No, it doesn't work like that. There's a lot that the doctor considers.
So that's there's another question that has just come up here before I go to other things. So it said the use of drugs and herbal at the same time, is that a drug abuse?
Well, I would say classify it under misuse.
Okay.
I would say classify it under misuse because I don't think the person has the intention to get high or anything that is abuse. So most of the time, we don't mix herbal and orthodox drugs. It's better, except your doctor says so, in which case you would have made calculations for any form of interaction that would take place or any form of probably dose adjustment. For example, if the herbal product is something that can bring down your blood pressure, and you're already on a drug that brings down your blood pressure to normal, and you mix them together, you might have hypotension and get into a serious problem. I've seen so many cases like that in practice. So it's good to go to talk with your pharmacist at least. Talk with your pharmacist. Tell them that I'm on this medication, and there's this herbal product that somebody is offering me. I'm always happy when people call me up to ask me to say, Madam Victory, somebody is giving me this, somebody says this product is good and I'm on this medication. Do you think I should mix them up? Then we advise them appropriately. So it's not good for you to just mix herbal drugs with orthodox drugs. Many times you don't even know what is in the herbal preparation. Many times they don't even know. Some of them even have hidden orthodox drugs. So it's good for you to get answer. Please talk with your pharmacist, talk with your doctor.
Thank you so much. So it's really important, please. If a drug is not prescribed, you know, if you don't know the components, you don't know what it's in it. And that might be something that might be causing harm. And even though it might not be drug abuse, it might be drug misuse. These are just nomenclature. The bottom line is, what does it do to you in the end? What you're doing, how does it affect you? How does it affect your health? So it's very important for you to be conscious of the fact that you could actually, in an attempt to take care of yourself, you can harm yourself beyond repair. Because I've seen cases in my career as a medical doctor where people, abuse things. And by the time they're coming to see you, it's just too late. You can't help them. It's either it's damaged one organ seriously beyond repair, or it's caused damage somewhere else in your body. So the information we're trying to pass here is try and get somebody to know what you're taking so that they can advise you whether it's the right thing, the right dose, and you're taking it at the right time. Okay. Now, maybe we should have a short break at this stage. I'm going to try and share my screen. We have quite a few questions coming on, but let's try and play. Let's honor people that have been supporting this program for us, so that we at least we're making them happy as well. So let me play. If I can share my screen, share that. That's it. Okay. So hopefully the caption will play today, because we had a bit of an issue yesterday. Let's see. Maybe. So that's Area Doc. Area Doc is an app that you can use to contact, doctors without. You can chat, you can call, you can, for free. And sometimes like this, it might be a good thing to download and have it on your phone. So now let's go into the next question that is just being sent in now. In a situation where one has been treated with malaria, or oh no, that's a different. I think you've answered that. If one is experiencing insomnia, and the only thing that makes them sleep is, what's this one? Closer Lexotan, and you are permanently on it. Is that a misuse? So basically, what this person is asking is, somebody can't sleep, and then they now permanently taking Lexotan before they can sleep. Is that a misuse of medication?
Well, like you said, the issue is far above abuse or misuse, because it's about this patient. The most important thing now is what is happening to this patient. Except the doctor places you on Lexotan, there's no reason for you to be on Lexotan permanently. You need help. So you should see your doctor so that you can be helped. You cannot be on Lexotan permanently. I'm sure your doctor didn't put you on Lexotan permanently. So you need to see your doctor. So that's another challenge we have with medications. The doctor prescribes something for a while, and then the patient continues forever to be on that product, on that medication, more because some of these drugs are in the hands of non-pharmacists, and they can easily purchase them. So they just continue, and like you said, Dr. Ogunremi, by the time they are coming up, some organs are already terribly damaged, probably damaged beyond repair. I want us to take that home. If there's any other thing to take home, we cannot continue to take drugs anyhow. It will not help us. It can damage us. It can ruin us. So if you find out that without Lexotan you cannot sleep, please talk with your doctor managing you, or you can see a psychiatrist or somebody who is a specialist in that field that can help out.
Yes. Thank you. So, using Lexotan to sleep constantly, that's not good. A lot of the time, patients come, they ask for this. You can easily get addicted to such medicine. At this time, it's not like whether you're using it, it's becoming an addiction. You're getting addicted to it, and you can't, you can't do without it. So for such, there are processes that needs, executing to make sure that your system is washed off it, And that is what your doctor will have to do for you. Just they have to slightly use the dose until you're able to actually remain your normal self. Now, Mrs. Lawal, a big thing in this environment is antibiotics. Anybody can get any antibiotics anywhere. If a patient, people who have malaria, they take antibiotics. Antibiotics is just all over the place. What's the worry here?
A lot of worries here. Now the whole world is having antimicrobial resistance as a very big challenge. That is because a lot of people have misused antibiotics. Apart from the antibiotic resistance challenge, which is a big issue, very big, because now small or little illnesses that antibiotics would have taken care of before might now result in death because the bacteria that is involved is already resistant to conventional antibiotics. Apart from that, they could be damaging their kidneys with overdose of antibiotics. So taking antibiotics without prescription is a very serious matter. Unfortunately, it is rampant here because, like Dr. Ogunremi rightly said, they have easy access to them. They're everywhere, they're on the streets, they are being hawked by just anybody. So that makes them freely available. And you now have to, like I said at the beginning of this program, imagine that your health is a car. You are the driver's seat. Please, drive yourself to safety. Make sure that you don't take drugs that must be prescribed without prescription. So, and antibiotics are very crucial here. Don't take antibiotics except you need them. A lot of issues taking antibiotics unguided.
Yeah. And like, again, just to add a little bit to that, you see, when you take the antibiotics, and just like you probably think you know that it's an infection. It might not be an infection. And these antibiotics, they have different, spectrum. That that different antibiotics will actually attack different bacteria because antibiotics are meant to attack bacteria. So if you take the antibiotics for the wrong bacteria, the bacteria that normally they're in your body, and they get used to these antibiotics. Maybe one day they just pick and then they cause an infection on you, and the antibiotics we now have to use, they become resistant. And then we'll try all sort of antibiotics, and it won't take care of things. So at that point in time, what it will cause is it will cause death because the bacteria that we're supposed to be treating is already been exposed to the antibiotics at the wrong time, and they're very smart. Bacteria, they're really smart. They start changing the gene in the way that, you give me today, you didn't give me enough. I will change a little bit. By the time you give me the next time, they just bounce back that, look, what do you want to do? So, and that then I can't help again. Then the doctors can't help, the pharmacists can't help. Nobody can help you at that situation. And that is one of the things that will cause it. Despite all the efforts that healthcare practitioners might be putting into place. Thank you so much. So what are the things that we can do as individual or even as a nation to actually see how to get to the end of this, or at least make effort? Because in developed country, for instance, there are guidelines that. Well, I was asking earlier on, it might sound a bit cynical when I said, do we really have a guideline in Nigeria? Do we have guidelines in Nigeria? Because if I'm here, I want to see, how do I treat maybe urine infection? How do I treat that infection? Different doctors will prescribe all sorts of things, and people pick it and then they start running with it. What do you think we need to do as a nation? Your advice?
It's a concerted effort. And sincerely, the problem on hand, we all have our share of the blame. So, like you have asked, how do we go about it as a nation? We need the government to enforce regulations to make sure that people comply with regulations. We need the government to sanitize the healthcare system. We need the government to ensure that drugs are handled by qualified healthcare professionals who are trained to handle them. Drugs should be left to the custody of pharmacists. Doctors should be empowered to prescribe, and then the prescription gets to the pharmacist. Prescriptions should not be serviced outside the pharmacy environment. We need people to get more aware of the dangers of self-medicating or not guiding themselves in terms of medication use. So they should know where to go for help, medical help, not just allow anybody handle them anyhow. So a lot of education needs to go on. We have some guidelines, Dr. Ogunremi, we do have. We may not have enough for us as a nation, and we are getting better by the day. So we need to just do more than get more guidelines, get the guidelines into use appropriately, and then get people to comply. It's a big one, it's hard. I know that drug abuse or misuse is a global problem. It's just that here we have a higher burden than probably in the advanced countries, more because of the regulations. So we need to have regulations, we need to have enforcements, and we need to have education. There's nobody that wants to on a normal day, except somebody is on a suicide mission, kill himself, damage his organism, because they do not understand the nitty-gritty. So if people are made to understand, we need a lot of education, like one of this program we are having now. I'm sure a number of people would have benefited from this. We need to know that drugs are very delicate. I always tell people, once you put that drug into your mouth or into your body, you have surrendered the mastership to the drug. The drug becomes a master, and the drug is not at liberty to do what it likes with you. So if you don't have knowledge of what it can do, then there may be a problem. Those who are prescribing have the knowledge of what this drug can do to your body. And so they can reasonably predict what will happen when you take it. Even if there's a side effect, this side effect is probably not new. There's probably a way to manage it. So please, it's better to go with drugs that we have knowledge of, drugs that we are trained of, and from the right sources, from those who are trained to administer these drugs. Maybe at this point, I will also mention another area that we're not looking into, and that is medication. I call it medication checkup. I think especially those who are seeing more than one doctor, or those who are on more than three drugs, need to go for medication checkup with their pharmacist. Just take all those drugs there, let them look at them for you. You might just be repeating some or taking the ones that you should not take, but your pharmacist will be able to sort them out for you. So we need more of multidisciplinary healthcare management in Nigeria. We need more collaborations. We need more education for all of us. Empowerment. We need the government to really come up strongly to ensure that the laws are adhered to. Because if we have a system where the only thing that works or that motivates people is their conscience, that is not good enough. It's not sustainable. We need enforcement. We need government to enforce the laws that protect their citizens. That takes me to saying government should enforce laws that will promote rational use of medicines. Apart from saving lives, it saves costs. So whichever way it is, government stands to benefit from it, the people stand to benefit from it. So all of us should decide as a nation that wants to hot drugs the necessary respect that they deserve. Because drugs are not commodities. They're not biscuits, they're not sweets. You can't just pop them into your mouth as you like, or you can't just apply them to your body as you like. What you apply might end up in your system and harm you. So we should have a will. Let's start with that will. All of us, the will to embrace rational use of medicines. And then all the appropriate should come on board. Thank you.
Thank you so much. So that's we have loads of questions, quite a lot of questions to be honest, and then I think our time. So we're going to try and answer as many as we can. I was going to ask, but I think you've done that. I was going to ask you about your advice, even for the chemist, for the pharmacist, in terms of all this. We've talked about the regulations and things, but we might touch on that. But let's answer one or two questions quickly. So one question says, are all drugs addictive? What makes them addictive? Hello? Hello? Wow, I think she's frozen there. Hello? Okay, so the question is, are all drugs addictive and what makes them addictive? I will continue until we get Mrs. Lawal back on. So yeah, hello? Okay, unmute, let me just unmute her. She seems to be doing something there. Okay, so it's not all drugs are addictive. Some drugs are addictive, but not all. Drugs are addictive. They're addictive because of possibly the way they work. The body sort of gets used to some of these things, like drinking alcohol. You take small amount of alcohol today and you continue to take that amount. The body feels that that's not enough. Then it gets used to that. Then you have to put a little bit on top of it to balance out. So if you're taking something for sleep, like somebody asked earlier on, if you take Lexotan for sleep all the time, maybe you're taking X dose. You discover that as you're taking this dose, it's just not, you were okay initially. Then your body gets used to it. You have to add more to it. And then your body gets used to that level, you add more to it. And then you add more to it. And then you can't get out of it. You're welcome, ma. Hello? Oh, please, can you unmute yourself if you can hear me? All right, so we went off. So somebody asked a question around addiction and I've answered that. Maybe I should go to, or let me just quickly answer. He said, all drugs are addictive. What makes them addictive? Try to answer that. More like.
Okay, it's breaking. I'm not hearing you properly, but I heard, are all drugs addictive?
Yes.
Can you hear me?
Yeah, we can hear you loud and clear.
Not all drugs are addictive. In fact, many drugs are not addictive. Drugs that are addictive are drugs that you cannot do without. And over time, you will need to take even more to get that desired effect. Those are the addictive ones. Like somebody who cannot just sleep without a particular medication. The person is addicted to that medication. But not all drugs are addictive.
Okay. Then the next question is medical marijuana. What's this one? Medical marijuana safer than pots on the streets? Is medical marijuana safer than the pots?
Can you hear me?
Yes, we can hear you now.
Okay, I didn't hear.
Yeah, somebody asked whether medical marijuana is safer than the pots on the streets. Okay, so
that's that question.
Okay, whether medical marijuana is safer than the pots on the streets. Sorry, we're having some technical difficulty here.
It's safer than what?
The pots on the streets.
Oh, okay.
Pots.
When there's a lot of controversies on medical marijuana, but what I know is that it's still under prescription. So, and it's for specific cases. So when the doctor is the one handling it, then it's within that prescription, the patient is being monitored. So it's medical marijuana, even though it's called medical marijuana, it's not meant for everybody to use.
Okay.
So it's still as dangerous as what is on the street if you use it without the prescription from the expert.
Okay. Then there's another question here. Alcoholism and drug addiction genetically inherited. That's more. You want me to answer that? So it's whether alcoholism and drug addiction is genetically inherited.
If alcoholism and what?
Drug addiction. So acts of alcoholism and drug addiction, whether it's genetically inherited.
What? I'm not aware that it is.
No.
I don't have any supporting documents for that.
No, they're not. It doesn't happen. So
I have not heard that. I've not come across that in practice.
So I think those are more of environmental thing than genetical thing. Whether you're going to be, alcoholism is when you expose yourself to it and you keep taking it. So it's an intentional thing that you do. Whether it's genetic, there's no, I don't know of any evidence that says that it's genetically. Then, what's this one? Is there a law guiding the PSN to say drugs can only be sold based on prescription by accredited specialists?
Please, can I get that again? Is there a law guiding what?
Guiding the PSN to say that drugs can only be sold based on prescription only by accredited specialists.
The Pharmacist Council of Nigeria regulates pharmacy practice, not PSN. PSN is a society. Now, the Pharmacist Council of Nigeria, they have laws governing the sale of medicines. Some medicines are over the counter. Some medicines are strictly on prescription. Some medicines are pharmacist prescribed. I don't know if that is what you are talking about, but whatever, they are meant to be administered, handled, sold by those who are trained to do it, and those are the pharmacists.
Okay.
Over-the-counter preparations are, some people are licensed, non-pharmacists. There are some non-licensed pharmacists that are licensed to sell over-the-counter products, like patent medicine dealers, but they are still licensed by the Pharmacist Council of Nigeria to do so. They are not allowed to handle prescription drugs. Prescription drugs are allowed to be dispensed only by trained, qualified, licensed pharmacists.
Okay, thank you so much for that. Then somebody said, a pharmacist shouldn't sell without prescription. So I think you've answered that one. There's another question. There's so many questions this morning. We answered the very last one now. Marijuana is just a plant. Is it really that dangerous?
What?
Marijuana is just a plant. Is it really that dangerous?
Yes, it is. It's not just a plant. It's more than that. Any plants or any product, anything at all that can damage you, it's a problem. Because marijuana can.
Thank you so much.
It doesn't matter whether it's a plant or animal, wherever the origin is, as long as it can create a problem that is not easy to resolve, a problem that is damaging, that you have to depend on. So please, marijuana is damaging.
Thank you so much. So we're at the end of this program for today. There's so many questions. We'll be answering your questions online. We'll go back there and then we'll type and answer them online. If you have other questions, you can also ask. We'll continue to just address those questions. Mrs. Lawal, we really appreciate your time. Thank you for the good work that you do in, Victory Drop in Festa. I mean, sometimes when I see those things that you do, I just feel like I feel we should have so many of you in this country. I think things will go in the right direction. Really appreciate you. And to our viewers, thank you so much for joining us again today. I hope you've learned one or two things. Monitor Your Health is a platform that we believe will enlighten, will educate you. If you have questions and you want us to actually solve for you, you can always ask us. Don't forget today that we've learned a lot around, medicines, prescription. Just make sure that whatever you do, however you do it, you do the right thing to help yourself. Do not take overdose. Do not take an unprescribed medicines. Run away from anything that you are not sure of. Call your doctor. Speak to your doctor. We also introduce area docs today. You can always download area doc. In fact, download it like you can. And then you can chat with doctors. You can call doctor, for free. You pay nothing. At least to get the advice that you want. And then our desire is that, an average Nigerian will understand what they're doing with their own health and then stay focused, stay healthy, uh, and then be safe. Thank you so much. And I look forward to meeting you again in the next edition, which will be coming up sometime. Thank you very much.